All right, so I've just gone and done a full head-to-toe assessment on my patient, including vitals, and I've checked her dressing. So I noticed that she had edema in her ankles, she had crackles in her lungs, she had no low urinary output, so I called the doctor regarding fluid retention, and he's given me a order for furosemide 20 milligrams IV, 1 dose now, so I'm going to go talk to my patient about that now. I'm washing my hands, while I'm in the patient's room, so I'm just checking the oxygen, the air, the suction's working, the patient's bed rays are on. The bed's going to stay at this height and the railing down for video purposes, and I'm also staying in the patient's room the whole time. And the bed's at an appropriate height for me. The patient's got the call bell. Hi, my name's Jenna. We had just met a little while ago. Could you give me your first and last name and date of birth?
It's Rita Wilson, January 26, 1945.
Perfect, thank you. And do you have any allergies?
No.
All right, so I had just done your assessment, like you said, and I saw you had some edema in your legs, and you're not putting out very much urine, so you're retaining some fluid. So I called the doctor, and he's got an order for furosemide for you, which is a diuretic that's going to help you pee. Are you okay if I give that to you now?
Yeah.
Okay, so again, it's going to make you pee a lot, and you also want to watch. It could lower your blood pressure, so you just want, if you need to get up, just let me know, because you may feel dizzy. I'm just going to assess your IV site now, because it's going to be given via IV push.
Okay.
I'm seeing that there's no infiltration or signs of phlebitis. Everything's intact. There's no exudate of any sort. There's no redness, no swelling, no streaks of any sort. I'm just going to feel around your IV site. Do you have any pain?
No.
Okay, any discomfort?
No.
Okay, there's no heatness or cooling, so that's good. I'll be back with your medication.
Okay.
Again, leaving the bed as is, washing my hand. I'm just checking here on my patient care orders. I've got Rita Wilson, and on her MAR, Rita Wilson, no known allergies, no known allergies. I see that there's an order today at 07:45, February 11th, that's today, 2018. Give furosemide 20 milligrams IV now. That's from her doctor, and that matches up with my MAR. So I'm just going to take a peek at the IV monograph here, seeing that I have furosemide. I see it's a diuretic, so that's going to help her pee, get rid of the fluid. I'm seeing that can it be given direct IV? Yes. Can it be given by all registered nurses? Yes. It says doses of 120 milligrams or less, and I'm giving 20 milligrams, so that's good. It says give over 1 to 2 minutes. I'm going to give over 1 minute because I'm giving I'm giving such a small dose. I see that there's no monitoring required, no reconstitution required. It's stable with normal saline. That's good because I'll be doing my saline flushes, and it's good for 24 hours at room temperature. I see there's an elder alert here, so I just need to watch for electrolyte imbalances. So I'm going to be monitoring their electrolyte levels, their mental status, as well as their renal function. I also see that I know orthostatic hypotension is a side effect that I need to be watching for, as well as things like constipation, cramping, diarrhea, nausea, vomiting, and such. I'm looking here on the dose, so for elderly it says initial 20 milligrams per day. That matches up with my order here, so that's good. I'm not going to be doing my med math. Now, I'm having to reuse the same ampule, so there would be a top on this, but for video purposes it doesn't have a top, and I'm just being conscious of the sharp top. I'm ensuring that I've got furosemide. It says 40 milligrams per milliliter, and it's within the expiry date. So my dose is 20 milligrams. And this is 40 milligrams per 1 milliliter. So I want to be giving 0.5 milliliters. I'll be drawing up 0.5 milliliters. All right. Again, these will be closed, but for video purposes, they have already been opened. That didn't touch my hand, so that's okay. So again, there is a little bit residual fluid in here, and I have been reusing the syringe, and it is just water in here, so it may be difficult to get rid of all the air bubbles. I'm going to overdraw here just so I can work to get out this air bubble. And again, that didn't spill. That's okay. Alright, so that looks good. With me, I'm just going to get rid of my excess medication in this thing, in my cup here. Right, I've got 0.5 mils. Okay. Okay. Alright. I'm now going to do my 3 checks, 7 rights. Make sure I can see this. Alright, so I've got my right patient, Rita Wilson, my right medication, furosemide, my right dose, 20 milligrams, so that which is, according to my math, is equal to 0.5 mil, which is what I have in my syringe. I'm giving it intravenously. I'm giving 1 dose now at 07:45. Giving it because she's retaining fluid. This is a diuretic. It will help get rid of it. I'll be doing my documentation afterwards. I'm doing my second check now. Got Rita Wilson, got my right medication. That was my right patient. Second check. Rita Wilson, right medication, furosemide, right dose, so 20 milligrams, which is equal to 0.5 mils, giving it intravenously. 1 dose now at 07:45. She's retaining fluid. This is a diuretic that will help get rid of that fluid. And I'll be doing my documentation afterwards. Got my right patient, Rita Wilson, my right drug, furosemide. I'm giving 20 milligrams, which is equal to 0.5 mils according to my medication math. I'm giving it intravenously. I'm giving 1 dose now at 07:45. Giving it because she's retaining fluid. It's a diuretic. It will help get rid of that fluid, and I'll be doing my documentation afterwards. Again, I'd be getting rid of this in the sharps container, but I need to reuse it. So while I'm here, I'm just going to do my checks for my saline flushes. Again, these would be in packages. So I'm just ensuring that I've got 0.9% sodium chloride, 0.9% sodium chloride, 10 mil, they're all intact, and the expiry dates are good. Alright, so I'm going to take this off, or first I'm going to get my cap ready. And again, I would be disposing of this needle, but for video purposes, I am needing to reuse it. Use that so I can take that into my patient's room. And while I'm here, I'm going to be making my medication label. Wilson, Rita, 3036, Rose, 20 milligrams per 0.5. Full rate, so I don't need to put a full rate, but I can just put that I'm giving 0.5 milliliters per 1 to 2 minutes. Next expires, like I said, within 24 hours, so February of 2018. Alright, so I've got that. I'm going to take this. I'm going to take my mark into my patient's room. I'll also be doing my hand hygiene first. Hello, can you please give me your first and last name and your date of birth?
Rita Wilson, January 26, 1945.
Perfect. And do you have any allergies, Rita?
No.
Perfect. Excellent. So how are you doing?
Oh, I feel good.
All right, so I've got your medication here for you. Again, I would be cleaning this for 30 seconds in a clinical setting. I'm going to want to open up my line there. Again, this would be a brand new syringe. Oops, a little bit of normal saline, that's okay. We'll just ensure that we get that wipe after. And I'll be giving up this a push pause. I'm going to give about 3 mils over 3 mils just as a push pause. Because my patient is retaining fluid, I want to give her the minimum amount. And I'm going to push and clamp as I do that. I'm going to remove this. I'd be discarding this. Cleaning my port again.
So like this doesn't matter if it goes in the same range.
Perfect. Now I'm taking my medication. I'm going to get my clock out here. I'm going to want to open my clamp here. Take this. Apply this. Alright, and I just want to make sure that I can see. And I will be starting now.
Complications coming from the pump had to be stopped before programming secondary, but you eventually found a spot to program secondary in that front. So, you mentioned that you already had a head to toe. Probably no nausea. You asked about nausea. Basically nausea. Reassess the IV site. Check them out. Go out, wash hands, check MR for that hydrogen. And ask for if she elevates. You might have the first time outside. I'll back in the one that was talking. Check MR for that hydrogen. Pretend it's 10 minutes.
Okay, and I know according to my watch that was slightly over a minute, but that's okay because it says to be given at 1 to 2 minutes. And I don't need to clamp that actually because I am going to give it a saline flush right away. Again, I'd be doing this for 30 seconds in a clinical setting. And for this second flush here, again, it would be open package. And I would be giving this for the first little bit to fully flush her line at the same med that I'm giving, at the same rate rather that I just gave the med, but for video purposes I'm just doing a push pause. And again I'm going to do 3 milliliters because my patient has already we're trying to get rid of the fluid. And I'm going to push and clamp. Perfect. My watch. Alright, Rita, I will come check on you in a little bit. Do you need anything else while I'm in here?
No, I'm
Right,
okay.
again, I'm leaving the bed and the rails as is. Be doing my hand hygiene. My charting here. 45. Temperature BSN 207. Alright, and again, I'd be going to check on my patient afterwards.